And I remember looking over my shoulder and my mom noticed this huge mass on my neck. I went in feeling fine. And the doctor looked at my mom and said, "I'm sorry to tell you, but your daughter has cancer. We can take this vital organ that you were born with, that was created, that adapts every minute of the day, different seasons, that goes up, that goes down, like this vital adaptive organ. And they think they could just put you on a pill for the rest of your life and you're fine." We don't have a great approach, really truly helping people with a diseased thyroid. Now we're going to remove that thyroid. They're going to try to treat you like you're a person with a thyroid, and they just send you on your way. When you make the decision to get your thyroid cut out, we went into it thinking this will take care of it all. If I cut this out, then I'm good. I'm well. Now you're living without a vital organ, but you never told what caused the problem in the first place.
Yep. Welcome to Save Your Thyroid, a podcast all about thyroid nodules. My name is Jennifer Holcomb, and I advocate for fellow patients suffering with this very common condition. Thyroid nodules impact 70% of adults in their lifetime, and the standard of care is surgical removal of half or all of the gland. But in recent years, safe and effective non-surgical treatment options have become available. In this podcast, I sit down with patients and physicians to discuss life with thyroid nodules, treatment options, and how to save the thyroid whenever possible. Today's guest is Dr. Rebecca Warren. At 19, Dr. Rebecca was diagnosed with follicular variant papillary thyroid carcinoma and had a complete thyroidectomy with high-dose radiation. After having her thyroid removed, she thought the problem was fixed until a few years down the road, she began to suffer from hormone issues that doctors would write off because her labs all looked normal. She suffered with depression, anxiety, weight loss resistance, and period issues with no help on how to get better. It wasn't until she decided to draw a line in the sand that no doctor was going to know more about her body than her did her health transform. She has spent the last 2 decades studying the literature, implementing protocols, using the most up-to-date functional labs and testing, and ancestral tools like fasting and diet variation to not only take back her health, but to help thousands of men and women avoid losing their thyroid, and for those that had their thyroid removed, actually heal and get better. Her goal is to help people avoid unnecessary suffering that she went through and help those that might be on a hopeless path right now. Dr. Rebecca practices with her husband in Chattanooga, Tennessee, and does virtual coaching worldwide. Her approach is simple but powerful. Get to the cause, support the body, and trust and know that the body was created to heal itself. Dr. Rebecca, welcome to the podcast.
Hi, thank you so much. I've already told you this, but I'm just excited to connect with you. Love everything that you do, and I'm so excited to be here.
Well, I'm just excited to talk with you. We were talking a moment before we hit record how my first exposure to you on YouTube was an interview that you did with a Dr. Mindy Pelz, which anyone viewing this podcast should definitely take the time to go check out that interview with Dr. Mindy Pelz and Dr. Rebecca, and then head on over to Dr. Rebecca's podcast, The Thyroidless Life. That's kind of hard to say.
It is hard. Don't worry. I really thought about that. I'm like, I'm just going to go with the title, even though it's hard.
Well, and I think it's a great title because it embodies what you're trying to do here, which is to try to reach out to people who have already lost their thyroid and help them to heal. But you also work with patients who still have a thyroid.
Yes.
So, but before we get into all of that, I want to just have you start by telling the viewers about your experience with thyroid cancer and thyroidectomy, because we have so many patients in our community who do have thyroid cancer today. So tell us your story, Dr. Rebecca.
Absolutely. So mine started, I would say 2.5 decades ago. And I always start with this story first because it starts to help make a connection for people that thyroid cancer, thyroid disease, thyroid nodules, it's not in its own. The thyroid isn't off by itself. It's interconnected with the entire body. And I learned this afterwards, right? My story started when I was 16 years old. Before I was 16, I wasn't very sick very much. I didn't think I was unhealthy. I would get strep. I would get, tonsillitis, ear infections, but it could always be managed with antibiotics, right? We've kind of normalized a lot of childhood diseases when in actuality, it's kind of letting you know the body's dysregulated. But when I was around 16 years old, I was walking out of the movie theater and I had intense pain. Like
Mm.
I thought I was having a heart attack. I vividly remember, there's certain scenes like that happen in your life and you just have a picture. I vividly remember this dirty sidewalk outside the movie theater because I just went to the ground in a fetal position. I was with a family friend. We call her my aunt, but I was with a family friend and she didn't know what to do. I was so afraid. I was so scared. She scooped me up. I didn't want to go in an ambulance. We went straight to the emergency room. I got hooked up to morphine because of how bad my pain was. And I remember when my parents got there hearing that I was having a gallbladder attack. But that at 16, he said it was like I had 1,000 stones in my gallbladder, all these little stones in my gallbladder. And I remember just being in and out of it. But, they say we can get it taken care of, right? We can just cut it out. Cut out my gallbladder, sent me on my way. I mean, the pain was so bad. I was recovering from coming off of morphine those following 2 weeks than the surgery itself. But I remember even at 16, I thought to myself, this isn't right. This can't be right. I get it. Gallbladder, and I didn't know anything. I had no guidance, no education, but I thought to myself, something must be wrong for this to happen to me at such a young age. I didn't know any friends or family member that went through that. And I remember at my follow-up appointment, I asked my doctor about it because at that point at 16, all I understood was weight loss. Well, maybe I need to lose some weight. And I remember talking to the doctor that I wanted to change things up. Like, I feel like something's wrong. And he said, don't worry, I'll get you taken care of. Like, let's finish up this kind of, follow up. And at the end of the appointment, he walks out and he comes back in. And I always date myself with this. He came back with a Xerox copy, the copy machine Xerox. And it had a food pyramid. I remember the sheet, a food pyramid, and like 2 little paragraphs at the bottom. And he gave it to me and he sent me on my way. And I remember thinking to myself, well, I mean, he's not really concerned that I was in the emergency room at 16 for a gallbladder attack. So maybe it's not that big of a deal.
Must not be that big of a deal.
Not big of a deal. No worries. Yeah. If we make abnormal things common, then it becomes normal. Right. And that's what happened. And then 3 years later, I was driving and I remember I was driving. I think I was home from college and I remember looking over my shoulder and my mom noticed this huge mass on my neck. And she said, what is it? We got to go get that checked. And that kind of started this domino effect of going to doctor visits, trying to determine what was going on. Right. And so I'll never forget another moment where I don't remember everything, but I remember the room. I have this image in my head where I walked into my doctor's office because I went in feeling fine, right? That day I walked in, I was sitting there. We had done a fine needle biopsy. We had done the ultrasound, blood work, and the doctor looked at my mom and said, I'm sorry to tell you, but your daughter has cancer. The good news is this is the good cancer to have. And I remember, which doctors still say that, which pisses me off. Okay. It ticks me off. Why? Because they think, we can take this vital organ that you were born with, that was created, that adapts every second, minute of the day, different seasons, that goes up, that goes down, like this vital adaptive organ. And they think they could just put you on a pill for the rest of your life and you're fine.
Yep. It's no big deal. You'll be fine. Just take this little pill.
This one little pill, right? And
I've heard it once. I've heard it a million times. It's so far-reaching and widespread. And I'm sorry to interrupt, but just
this is good.
That lack of understanding of the nuance of the function of the thyroid gland, right there, tells me that we really don't know what we don't know.
No. And a good point that you make is that, when we're looking at studies of like post-thyroidectomy patient groups, what we're looking at is mortality. But what's the point of living a long life if you're suffering through? How many people are affected by depression and anxiety and a brain fog and a body that they feel is just falling apart? Like, it's not just about dying, it's the quality of life.
Right.
And this flippant attitude about no big deal cutting out your thyroid follows into the treatment post-thyroidectomy why so many patients have so many issues post-thyroidectomy, because it's no big deal. We don't have, actually, within the medical system across the board, there's just so much controversy there about T4 and T3 and what labs to do. We don't have a great approach to helping, really truly helping people with a diseased thyroid. Now we're going to remove that thyroid. They're going to try to treat you like you're a person with a thyroid, and they just send you on your way. And that's what happened to me, right? Like when you make the decision to get your thyroid cut out, you go into it. And this is what my mom and we did. We went into it thinking this will take care of it all, right? Like if I cut this out, then I'm good. Like I'm well. And what ends up happening is you go in, now you're living without a vital organ, but you never told what caused the problem in the first place.
Yep.
If you have an autoimmune thyroid issue, guess what? Even if you remove the thyroid, you still have an autoimmune issue.
Yes.
If you have a toxicity issue, whatever triggered it in the first place, you think you're fine. And over time, if it's not addressed, it just comes back up.
Mm-hmm.
And so for me, just so you know, there is in the research, there's a clear connection between gallbladder function and the thyroid. Big, clear connection. I used to give talks like where there'd be like 300 women and men and women in the room. And I'd be like, okay, how many of you have thyroid, issues? How many of you guys have had a gallbladder issue in the past? And I mean, like all these hands would go up and they'd be shocked to hear that. And so there's all these connections, right? Mm-hmm. So when I ended up getting high dose radiation, completely unnecessary. So I had a follicular variant papillary carcinoma. It was encapsulated. Now we know so much more with these different types of, especially more so the encapsulated follicular like papillary carcinoma. High dose radiation wasn't necessary, but I did it. And when I did it, I remember, again, I had to stay in a hospital room. I was there for 2 nights. For me, I will say this, and a lot of people might be able to relate to this. That whole period of time I blocked out. It was scary.
Yeah.
It's scary to hear that you have the C word. It's scary to feel like you might die, like you don't fully understand everything. And you really, essentially, you're making decisions out of fear, which should never be done. Right. And so for me, when I did my radiation after my surgery, I remember I was in a hospital gown. I remember being in the hospital room. Everything's covered in plastic. I remember them coming to the door and they were fully protected. They had this little can and this radioactive pill, essentially. And I remember sitting there feeling so vulnerable, like I'm about to put this pill inside my body. Everything's covered in plastic because I will be oozing radiation. How is this okay? Like how I could not understand how I got there and no one educated me. I didn't feel better just because I had it cut out.
Yeah.
And they sent me on my way. They put me on Synthroid. And I will say this, I felt better the first year or two. But then my period started becoming irregular. Okay. The doctors didn't really care. They were like, well, you're not really trying to get pregnant. And I'm like, okay, that's weird. But I started struggling with brain fog. I mean, I was like 20, 21. I started struggling with depression and anxiety. I loved school. I had great friends. I went to a great church. And I couldn't understand why every morning I would wake up with this heaviness. Like, just like, it was like a heavy blanket I couldn't shake. And then at night, I would be anxious. I would replay things and worry about things I had no control over.
Yeah.
And then I couldn't lose weight. And I remember talking to my doctor about all of this. And they were like, well, your labs look fine. They would do my labs. They would sign off on it. And I'm like, but I don't feel fine. Like, this doesn't feel right. Eventually, the doctor told me, do you understand calories in, calories out? Because, of course, you're overeating. At that point, I was doing CrossFit and I was being a vegan, which, let's be real, I was just being very restrictive with my calories because he kept telling me, it's my fault. Like, it's just you. And it got to the point where eventually it was all in my head. They asked me if I wanted some antidepressants. And at that point, I was like, what? Why do I don't understand. Like, I thought things were going to get better. I don't understand what's going on. And in my story, I actually got into a car accident on top of all of that. And my brother referred me to a chiropractor, a doctor of chiropractic. And that's when my life changed. Because when I walked into that office, in all of that, it was the first time a practitioner sat in front of me and said, let me explain how your body works.
Yeah.
Your body's created to heal itself. It didn't fail you. Okay. It doesn't make a mistake. Like when it starts doing that, those symptoms are to guide you. You need to listen. You need to identify. You need to dig deeper. And I remember crying in my essential like report of findings because I felt so helpless. In fact, for the 7 years post thyroidectomy, I would cry whenever I shared my story because I felt like helpless and everything.
Yeah.
And it was in that office where I drew a line in the sand and I said, no one's going to know my body better than me. I fired my doctor because he wasn't ordering the right labs. He wasn't willing to switch my meds. And at 21, I hired a doctor that would communicate with me, that would try the things that I wanted to try, that would order the labs I wanted to order. My previous doctor was only testing TSH. This doctor tests all the panels. I found out I wasn't activating T4 anymore. I was able to get on the right meds for me, and it transformed my life. And that's why I decided I was going to be an eye doctor. I go 0 to 100 real quick. I'm like, I'm not being an eye doctor. I want to be a DC. I want to help people get down to the cause, but there's a lot there, but the biggest thing is I had to draw that line in the sand and understand that it's up to me.
Yeah. Wow. That is so powerful. Like I get chills just listening to you tell it. And I've heard it before on other podcasts, but it's like one of the things that I think is so fundamental about your story is something I'm always trying to drive home to our patients in the Save Your Thyroid community, which is you have to be your own advocate. Yes. You cannot just hand your health over to someone else and expect them to care as much about it as you do. Not only that, you have to live your life in your body. They don't. And you've got to live it for the rest of your life. So you've got to do what you can to take care of this body that you're in for the rest of your life. I want to just tell really quickly what happened to me because it's so... it's parallel with your story. And I just want to share this with you because I don't think I've taught with you about this when we were communicating. So when I was almost 19, which is so funny, I was at Auburn University. I was in the marching band. I loved being in the marching band. I was a nerd. You know? Make fun of me, if you will, in the comments.
Hey, own it. It's yours. Yeah.
But I loved it. And one thing that's really, one thing about the Auburn marching band that's kind of like special about them is they do this high step marching, this very traditional style high step marching. And they do this thing where they side to side while they're marching. So like all of the instruments, they're marching down the field and they're side to siding with their upper body. And I had a really hard time, like not falling over while I was trying to do this. And so it's the very first game of the season. I'm on the front row and we're marching out for pregame. And I am trying to not fall because there's a row of sousaphones behind me. And I don't want to get trampled by them and the rest of the marching band.
Yeah.
So I'm putting my feet into the ground hard as I can to not lose my balance. And I'm breathing really heavily and it's going like really fast.
Yeah.
With the tempo of the song that we're playing. And so we came off the field after that was over and I sat down in the stands and I looked down and my ankle was swollen. And I was like, well, that's weird. And by the time the game ended, and Auburn's a big campus, we had to walk all the way back to where we had parked our cars. And I had to have a friend like help me. Like I had to put my arm around his shoulder and limp all the way back to my car because my ankle was swollen. My knee was hurting. And I went to the doctor and found out I had torn my meniscus in my left knee.
Oh my goodness. Yeah.
And so this is where I dropped the ball. And I went into this doctor and in Auburn. So I didn't go home. I didn't, get my parents' advice about how I should deal with this. I'm a big girl. I'm going to do this on my own. And the doctor's like, he pushes on a specific point on my knee. He's like, does that hurt? And I said, ow, yes, it does. He's like, oh, I know exactly what's wrong. We just need to, stitch you up right there in your meniscus and you'll be right as rain. You'll be good as new. He didn't even take imaging of my knee.
Oh my goodness.
He just said, you need this surgery. And I was like, okay, sign me up.
Yeah. Yeah.
And so a week or two later, I went in and had surgery, and my life has never been the same since. I had a week of lying on the couch, writhing in pain in my apartment,
Oh
and
my
my whole
goodness.
leg from my hip down to my ankle was like a watermelon. It was so swollen and it was so painful. And they had been saying to me, you should be able to get up and walk around, you know, within a day or so. You should be able to move. And I couldn't. And I have a really high threshold for pain. But I couldn't. Every time I would try to get up off the couch, I would nearly lose consciousness or vomit from the pain being so intense. Like not even like a visceral response.
Oh my gosh.
So fine. And I kept calling them and saying, something's wrong. And they were like, oh, you're fine. You should be walking around and all this stuff. They thought I was trying to get prescription drugs.
Yeah.
So a week after my surgery, the band director, because I was a music ed student at Auburn, he was concerned about me. So he came to check on me and he said, why have you been back to class? You said you would be back to class, you know, within a week. And I said, I don't know what's wrong, but here's my situation. He saw my leg and he was horrified. And he went, oh, I was like you. I will never forget this as long as I live. He walked across the living room, picked up the phone, called my doctor, and he said, something is wrong with this child. I'm bringing her in and you're going to figure it out. Long story short, I had a second surgery. They found out I had systemic staph infection.
Oh my gosh.
It wasn't in the wound. It was in my bloodstream.
Oh my gosh. That's so dangerous.
Yeah. I could have died.
Yeah.
If they had just left me alone, I could have died.
Oh my gosh.
I was in the hospital for a week on high dose Cipro.
Oh my goodness.
I had to drop out of college because I could no longer walk. I lost like 40 pounds within like 2 weeks because I just was so sick from the medicine. Oh my gosh,
you had an infection.
Yeah. And so I had to lose my scholarship, drop out of school.
Oh my goodness.
Everything changed from that point on.
Yeah.
And I'm disabled. I'm 41 years old. I have disabled parking and I walk with a limp now to this day. So all of that said, when it came to my thyroid, when I started having issues with nodules, and my thyroid nodule rapidly grew overnight because I had an allergic reaction to some medicine. Ironically, it was Cipro.
Okay.
But it doubled in size overnight because I had to take some Cipro for a UTI.
Wow. Oh my goodness.
So I went from, I don't need to have surgery, this is just an annoyance, to I have this mass in my throat that's choking me to death.
Oh yeah.
And I had to start thinking about having surgery, and I could not get out of my mind what happened to me when I was a freshman in college. And I thought, what if this same type of situation, I mean, obviously it wouldn't be identical, but what if this same kind of thing happens to me again? I have all of these allergies to antibiotics. If I have a post-op infection again, they can't, there's hardly anything they can give me for it. And I could not I couldn't reconcile the idea of having to go through that and the possibility of living through that again. I have children. I have a husband now. And so ultimately, I was just begging God to show me some alternative, and he did. And that's how I discovered RFA. So I just feel like, all of that said, my story, your story, every patient's got a story about something that either they know in their gut or they've been through something like this. They just have this sense that, like you said, this isn't right. Like we have this organ in our body for a purpose. God put it there for a purpose. It's designed to operate a specific way. And so taking it out and replacing it with a pill is just not adequate. Now, if you have to do it, you have to do it. And then you can work through, like what you do with your patients, work through trying to heal and balance and optimize everything. But if you can avoid it,
yes, please,
that is the best, in my opinion, the best course of action. Thanks so much for watching this episode. I hope you're enjoying it. This podcast requires a lot of my time, effort, and resources, but it is a labor of love. If you'd like to directly support my work here, you can do so in 2 different ways. You can purchase products from one of my affiliate brands, or if you would prefer to make a donation directly to the podcast, you can do that as well. Links to do either are located in the description below. Every dollar contributed goes right back into this podcast. Additionally, if you'd like to support the Save Your Thyroid patient advocacy community, which is working toward becoming a nonprofit organization, you can donate via our fiscal sponsor, THYCA, Thyroid Cancer Survivors Association. Simply visit thyca.org, click donate, and designate your gift for SYT. To learn more about us and the work we do, please visit saveyourthyroid.org. If you have any questions about any of this, don't hesitate to email me at saveyourthyroid@gmail.com. Any way you choose to support the podcast or the SYT community is sincerely appreciated. Your generous contribution keeps this work going and helps us to help more patients like me and you. Thank you so much for watching, and now back to the podcast. So you've told us about your experience with thyroid cancer and the surgery and the radiation.
Yeah.
What was it like for you after? I mean, you went through this training and you became a holistic practitioner, but
Yeah.
what was the path for you going from that point forward to actually finding a place of healing? Because I know so many patients after thyroidectomy, like when I was researching the potentials, I was in the communities on Facebook where all of these mostly women are saying, my life is a disaster now.
Yes.
So how did you walk through that?
You know, the first thing I will tell you, and I'll say this, like, it never ends.
Right.
I think healing is just a journey. I don't think we can ever be fully healed. And especially in this stressful, toxic world, there's seasons you do more for your health. There's seasons you do a little bit less, but you always have to be conscious of it, right? But without a thyroid, and because sometimes people are like, it just sounds so depressing living without a thyroid. I want to hear good news. Like, well, no, we got to be real. It's hard. Yeah. It is harder. I will have seasons, like especially postpartum, where my body's dysregulated and I stop responding to my thyroid meds. I gain 20, 30 pounds and I have the healthiest lifestyle in the world. And it's a frustrating thing to have to essentially start over after 20 years. It is harder, but you don't have to suffer through. And I think even kind of going off of what you said, you know, one of the biggest thing that frustrates me is, especially for women, is, and we're in the South. So a lot of my first clients are like, well, my doctor's so nice though. I'm like, your doctor is nice just because he kind of makes eye contact with you, but he's slowly killing you because he's not listening to you. And so many women, we know there's gender bias in medicine. I came across a study that shows that as a woman, if you go in and you complain about pain, like God forbid it's female-oriented pain, you are twice as likely to leave that doctor's office with an antidepressant medication, like a prescription for an antidepressant, than a male will leave with pain med prescription. Okay, you have to understand that if you do not go in and you're not willing to advocate for yourself, to speak up and to kind of challenge, then you get stuck. And for me, like my journey, it took time. There's a few different things I had to do, and there's a few different things you have to do post-thyroidectomy. Is that number one, you have to find the right dosing for you. And this is really hard because I don't know, I've encountered doctors that just have egos. They just suck. They just have egos. Yeah. I've encountered doctors that just don't know. And they don't have the time to know. And this is what they feel comfortable with. The guys and gals with the egos, fire, move on. The ones that just don't know, like, well, you need to find someone that does, right? And either way, like, I have so many people that are like, well, what drug should I do? I don't know. Right. Your history is your own. And it's frustrating because whether you do synthroid, levothyroxine, Cytomel, NDT, tyrosine, whatever you do, it's not a straight shot to where you need to be. You have to retest and sometimes tweak and tweak and tweak. And the thing that sucks is that takes time. Yeah. We're talking about every 6 weeks until you find where you need to be. I have doctors that I got on a call with a doctor a few years ago with one of my clients, and I actually got to speak with him, and he was like, and he was great. He was great to work with. And he was like, all right, yeah, I put her on this med and I have her set for 3 months. I go, that's not the gold standard. You should see her 6 weeks. Yeah. And he's like, well, I think she'll be fine. I go, if she'll be fine, you'll know that at 6 weeks, right? Why don't we get her checked at 6 weeks?
Yeah.
And he's like, all right, we'll get her checked in 6 weeks. Because a lot of people get on meds and then they have to wait months later and they don't understand why they feel like crap. They think it's all this stuff, different stuff. They'll start fasting. They'll start doing carnivore. They start doing all these things, not seeing the results. Then they start punishing themselves with food and exercise because they're not losing weight. All these disastrous things happen just because you went to a doctor that either didn't want to or didn't know. And that's up to you, unfortunately, right? You've got to do that adaptation. So for me, I had to find the right meds. What meds have I done in the last 20 years? What have I not done is the question. After each pregnancy, right now, I'm having to switch it up because I had my third. So you have to have the ability to adapt. So the first thing I had to do was find the right meds, brand dosing for me, and then find my optimal dose, right? Then the second thing I had to do is heal from going hypothyroid. What cell is not affected by T3 in the body?
Yes.
Right? Everything. It slows down everything. It's energy production. So we're talking about HCl. It can cause an imbalance, microbiome imbalance in your gut. It can cause rashes. It can cause hair loss. It can cause, depression and anxiety. There's all these things. And so once you find the right dose, then you need to heal. Now you need to nourish and love on and kind of repair from going hypothyroid. And then I had to identify why my thyroid got sick in the first place. You're not told any of this, right? Not only are you not told any of this, but 99% of I don't know if there's one person I have worked with that felt they made the decision with a clear conscience, like calmly. Most people are making this decision out of fear. And that is not right. Informed consent means you get all of your options and you look at benefits and risks, right? You get the benefit and risk of active surveillance, benefits and risk of radiofrequency ablation, benefits and risk of the surgery, but that's not what happens. We are scared of the C word, which the C word in thyroid cancer is very different, but they don't explain that. You've got that C word there, and automatically you go into sympathetic. So not only do most people not know what the thyroid is, where it is, what it does, what causes it to be dysregulated, but they don't even know what to do post-thyroidectomy because the whole process was out of fear. And when you're in sympathetic, you're in survival mode. You can't process that. So for me, I had to go through all those stages and then understand that, like, for the rest of my life, I've got to do this. I have to pay attention. So if something's off, and I teach this to those post-thyroidectomy, something's off, the first place I go is to my blood work. The first place I look is, do I need to change my meds? Do I need my blood work? But guess what? Doctors don't do that. They're going to treat you without a thyroid as if you have a thyroid. Oh, you don't need to do that. Oh, these labs look fine. Oh, it's fine. One last point I'll make is that when you have a thyroid, this is how amazing the thyroid is. If you don't convert, there are genetic changes that can happen, T4 to T3 conversion. I've talked about this in my podcast. But if you can't convert and activate your T4, your thyroid will step up to the plate and make more active T3.
I did not know that.
It's Dr. Bianco, his book, Rethinking Hypothyroidism. It gets all like sciencey and like his history, but he spent 35 years studying this. And it's frustrating to me because if we understood that science, if we understood that now that you don't have a thyroid, T4, if it doesn't convert into T3, you're out of luck. You know, you don't have enough T3. You don't have that backup system there.
Yeah.
If doctors understood that, then they would not only do full labs, but they would be willing to try whatever combination therapy you might need if you need it. But no, the gold standard for them is Synthroid THT4. So it's really important. This is what I will say too. And then I'm done with this segment here, is that you've got to understand whether you're getting your thyroid removed or not. You need to understand what labs you need now. You need to understand all of your choices. And I just referred someone to you. Someone commented on my YouTube and they're like, I don't know what to do. This is growing. And I was like, hey, you need to check out Save Your Thyroid. And she's like, well, 2 endocrinologists said there's no point just to get it cut out. And I'm like, they don't know what they are talking about. If you go to someone who their toolbox, where they went to school, where their passions are, whether they care to, read this research or not, that will affect what they recommend to you. So if you go to 2 endocrinologists that all they know is surgery, of course they're going to say that, So just understanding, even if you end up having to get your thyroid removed, I had someone do a consult with me and she had to get it removed. I mean, it was fast growing and all this, all these kind of like risk factors. And she's like, I just want to meet with you because I want to know what labs now I need to get. I need to know how to optimize my thyroid hormones now so that when I'm done, like with the surgery, I can get back on my feet better and faster. And I'm like, that's informed decision making right there.
That is so important. I love that you shared that because I find that the patients in our community who do have to choose thyroidectomy for whatever reason, there tends to be a theme with the things that they'll post in the group. They'll say, I've decided to have a thyroidectomy, but now I can lay my head on the pillow and sleep at night knowing that I made this decision, knowing all of my options, talking to multiple doctors in multiple specialties, getting all of the information I needed to make an informed decision. And I think that's so critical because
that's a big deal.
If you don't, you're going to feel like a victim for the rest of your life. And I don't want a victim culture in this community. We need to be informed and educated and empowered.
And I love that. I love that too, because there's people, I have discussed studies in Japan, studies here at Sloan Kettering, where they are legitimizing active surveillance as a true approach to this. But fear will drive people away. Like why keep your thyroid if you're going to live in fear? Healing begins here, right? If you understand, number one, your body's created to heal, it wants to work with you, not against you, but also understand that there is research and science being done with, the radio frequency ablation and active surveillance. You have to live in knowledge and truth that you're making that right decision, whether you're doing whatever treatment you do, even if it's post-thyroidectomy. You can't be in fear and you have to find your voice regardless what path you take.
Amen, sister.
You and I are right there with that, right?
Well, I really want to hear the story about how you discovered the fact that these non-surgical treatment options, primarily radiofrequency ablation, has been around the longest in the U.S., but there's a handful of other procedures out there now, and they all have advantages and, certain types of nodules that are better for, different specific situations that they are just best suited for. But specifically, you and I have talked mostly about radiofrequency. I can't talk. Radiofrequency ablation, RFA. So tell me the story about how you discovered that this is a thing.
Okay, so this is fun. This is a fun story. So listen, this is what I think is really important. My husband and I are both functional practitioners. I primarily work with women, but now I'm opening up to men again. I'm like, I have so many people that have been reaching out. I'm like, I'm going to work with men and women, specifically sex hormones, thyroid hormones, and healing after thyroidectomy. My husband works with men, and I support him on the thyroid side with that, and children. So there's one thing that my husband and I can admit to is that we're wise enough to know that we don't know everything. And if you find a practitioner that knows it all, run the other way.
Yeah.
Because science is about retesting. Yes, we might have a proper way of doing things, but you have to be open to what might be there. What hasn't been studied yet. That's something I do appreciate about Dr. Antonio Bianco, who's been doing these studies for 35 years. He kind of was ostracized because he talked about utilizing T3. How did he go from T4 is the way? No, like he admits, like, you know, he's in the endocrinology world. He was like, I think, president of the American Thyroid Association. He's internationally known.
Yeah.
And he admits that when women would come into him and say, I'm not losing weight, he would be like, wouldn't believe them. But what changed his mind? What changed how he goes about it? What he speaks about? What he studies in his research? What changed it? You, people like you saying, this isn't okay. I don't feel right. It's not working. Like, he had enough of his patients be like, no, that's not right. I don't feel right. And I'm not okay with this. And he had a heart and he opened up to that. So for me, like, I know that I don't know everything. And that means every year I'm changing my protocols. Every year, I mean, like, my team hates it because they're like, you have a protocol that works. I go, but what if there's something better? Like, there isn't going to be something better in 3 months. I'm like, but what if? Like, I just want to double check. But I found out about it because I actually worked with a client. I had a coaching client of mine that came to see me, and I supported her with healing post the procedure. Like, we kind of did protocols to go along with the procedure to continue to increase the shrinking and all of this. And she's the one who told me about it. And I said, and this was a few years ago now. And I was like, what is this? Research the doctor, gave her notes to talk with the doctor about what to look at. I literally was on the phone with her at her doctor's appointment. And I was like, what is this? And so she introduced it to me. And in a way, like, I had heard about it before, but I wanted to know the science on it to better support her, right? So of course I knew about it. I mentioned it, but it was the science behind how it's done, why it works, that she was able to present to me. And then I said, I shared something on Instagram, and she messaged me and she's like, Jen is how I found my doctor for RFA. And it was like a full circle moment where she's the reason I went deeper into it. And then it was because she found the doctor through you. And so that, you know, you need a practitioner that understands that, listen, I'm willing, let's try some things out. Because this is the last thing I'll say with this is that I love research and I love science. And but if you're not asking the right questions, if you're not, you know, checking the right population, like one frustrating thing that I keep coming across is like studies on if testing TSH, T4, and utilizing T4 therapy is enough. And a big study that was done and that doctors and endocrinologists like to use, they're like, it says, oh, there's no difference. T4 is fine. But they looked at a healthy population going into like having dysregulation. They didn't look at a dysregulated population. They didn't look at, I'm hypothyroid. How do we get you at a hypothyroidism, like being hypothyroid, and maintain you out of it? So if you go off of that study and you are hypothyroid and you're trying to be optimal, that population, that study they're using doesn't apply to you, but they're going to apply the findings to you. So I always tell my coaching clients, my community members, I said, N equals 1. In science, like a case study, it's not like, you know, it's not like a big deal. A case study is about one patient, but N equals 1. You are the study. You are worth it. And I try to tell my clients to live in such a way that they want to study you, right? If something's not working, then live in such a way that they want to ask, what are you doing? And I get that all the time. I'll have a lot of patients, you know, clients that'll be like, oh yeah, my doctor asked what I'm doing. That they're so like proud of me. I'm losing weight. I feel great. They'll ask what I'm doing, but that's as far as they go. They never call me and be like, hey doc, let's talk about these protocols. They'll just be like, good job, and send you on your way. And it's like, well, doc, shouldn't you be doing that with your other patients? But that's how I found it. And I think it's a really powerful option, especially there's things that trigger, like, you know, kind of what triggered that growth. There's things that trigger it.
Mm-hmm.
And until you're able to identify, a lot of people, they haven't identified what it is.
Mm-hmm.
It's still starting to grow. I mean, that's a fantastic option to kind of stunt that growth, especially as you continue to heal your body.
Yes, I absolutely, that is my biggest, like, cheering on these thermal ablation procedures point is patients who want to get to the root cause of what they're dealing with can use something like this to arrest it from getting any worse.
Yes.
And then still keep working on their thyroid, working on their hormones, working on their health in general, you know, clean up their diet. You know, we always have patients wanting to know, what should I do lifestyle wise? And unfortunately, and I just need to make this disclaimer for the viewers, is that, you know, within our Facebook community, we have to really limit our conversations to the procedures, because we want to keep everything based on, like, what do we have data on, and what do we have, like, we're talking about procedures that people can't find information about anywhere else. And so if we start having this forum, you know, filled up with all this lifestyle stuff, which everybody has their own ideas about lifestyle, unfortunately, that it gets to be an unhelpful community. And so we actually do have some people who from our community who decided to start a community based on, you know, lifestyle interventions and supplements and things like that. But the point being that not everybody is going to have the same needs or the same root cause, but everybody does have, you know, the same symptoms of, oh, I can't swallow, or I can't breathe, or, you know, this thyroid cancer, I don't want it to keep growing and spread. Those are all things that patients want to, you know, stop from continuing to happen, and then go back and address, where did this come from? And I don't know, do you have any thoughts on what root causes are for thyroid nodules and thyroid cancers that you would like to share?
You know, there's yes.
I mean, I know it's probably so multifactorial that we couldn't discuss it in an hour, you know?
I will say this. Usually most of my clients, when they start working with me, I'm like, stop listening to podcasts, stop reading stuff. Because, you know, 20 years ago, it was a desert for information for you. And, like, you know, 19, when you started your, like, it just, we didn't have resources at all. Like, there was nowhere I could turn to. I think back then we did have a Stop the Thyroid Madness. That was a great resource because it was a very patient-focused website.
Yeah.
But now it's a fire hydrant of information.
Yes.
I mean, listen, if you want, you can find why iodine is good. You can also find why iodine is bad.
Right.
You can find why vegan's good, why vegan's bad. Like, it's a fire hydrant of information. And this is what I teach my clients. Unless you understand the foundations and principles, you'll get swayed by everything. You'll question everything. I mean, I even have some clients that are like, well, they say vitamin D supplementation is wrong. And I was like, it's because you don't understand, right? You don't understand how to supplement the vitamin D, the testing and all of this. And so I do think if you don't have the foundation, you can easily be swayed. Environmental, you know, Dr. Nikki Foroff, I came across one of his interviews, right? Like I remember years ago, because he worked on reclassifying the name, which the name they changed it to was not easier. I'm like, of course you make the name more complicated. He wanted to reclassify one of the cancers, which is the encapsulated follicular, papillary variant. Okay, like mine. But the name is worse. It's like really long, and I don't even remember it. But I remember coming across, and he shared, you know, an interesting thing, and you guys can access this on YouTube. It's a very short video. I read all of his studies. I read all of his videos years ago, or watched as many interviews that there was of him. But he talked about, like, looking at genetic mutations, and he said, you know, the more aggressive form of genetic mutations for thyroid cancers have actually decreased through the years, like, and cancers due to radiation and all of these things, like the aggressive genetic presentation, like those changes have gone down. The more benign are increasing, right? These genetic changes. And he straight up says it's environmental carcinogenesis. It's an environmental thing
Mhm.
that's now occurring. And I always share this example. I remember hearing this when I was first a patient, and it stinks. Like, this is what I heard. Let me explain. Okay, so what I heard was, in the environmental world, if we're studying animals, if we're studying species, if there's a water, if there's a lake where all these fish started growing third eyes, we would never just go in there and be like, oh, this is weird. A third eye. Let's just cut off all the eyes and throw the fish back in. And also, let's just add a pill into the water to stunt cell growth. Maybe those third eyes wouldn't grow.
Mhm.
That's insane. The first thing they would say is, what the heck is in the water?
Right.
What has happened to the environment that
Mhm.
now we're seeing these offspring where these diseases are occurring? And when I first heard that as a patient, I said, yeah, why are we seeing more and more issues with women and menopause and fertility? And now, 20 years ago, it was rare to have thyroid cancer. I mean, anyone with a thyroid can get thyroid cancer now.
Mhm.
And it's crazy to me that essentially what I have seen is there's not as much energy, money that wants to go into the why
Mhm.
because they've got it all figured out. Why does the why matter if we can just cut it out?
Mhm.
I came across a study because my husband's really obsessed with the idea of possibly growing back a thyroid. He thinks, like, he's obsessed with the science of stem cells and all of this. And I remember a few years ago, I came across a doctor that was talking about the studies on regenerating a thyroid with stem cells. And I showed it to my husband. And at the bottom, he says, but the truth is, essentially, we have a good approach to thyroid diseases and thyroid cancers. We have a good approach already. So essentially, it's not that big of a deal.
Yeah.
And I was like, that's what it all comes down to. They can cut it out and put you on Synthroid. Like, what's the big deal? And Synthroid did a really great marketing campaign for decades that still influences the market now.
Yeah.
So what's causing it? I mean, it can be multifactorial, autoimmune, gut related. It can be toxicity. I think toxicity is a major one. Heavy metal toxicity, chemicals. It can be infections like Lyme and mold. And I do agree with you. If a lot of your members aren't cautious, you can get overwhelmed.
Yeah.
You can get to a point where it sounds like when the women, like when my clients come to work with me, everything is toxic.
Yeah.
Everything's going to make me sick. And then food becomes a punishment, or like food just becomes like this negative thing. And most of the women I work with undereat. I have to make them stop fasting and eat, and they start losing weight and they're shocked. But all this information gets you overwhelmed, and you can feel like the whole world is going to hell in a handbasket because it's so toxic and you can't avoid anything, which is true. But if you go about it the right way with the right information, like identify what was your trigger, work on that, let the body heal, chill out a little bit, then work on something else. But I definitely think, I will say, I did identify for mine. I had excessive levels of lead toxicity and mercury.
Wow.
And I could see that when we started looking at my family history, like coming down from my mom, all these fillings and stuff. And so that was something that when I started working on, I will admit this as a practitioner, I have learned a lot through the last 20 years, but I'm the type of person that just wants to go all in. I'm like, if I'm going to detox, I'm going to detox all in.
Yeah.
And that is the dumbest way to detox. You have to go super low, very slow.
Yeah.
But I was like, lead, all right, let's pull it all out. A lot of people think like that. It messed up my brain. It messed me up. And I had to go all the way back. Like, I had to restart my healing because I went too hard, too fast. So that's why I do agree with you. Like, having the right guidance, the right functional practitioner walking this alongside you helps you kind of like put away the noise and focus on what specifically is for you.
Wow. That's so helpful. And I think a lot of patients in our community do want to find a functional practitioner. And unfortunately, they can be hard to find. So I would love for you to share with the viewers, how can someone, if they decide they want to work with you, how can they do that?
Absolutely. So they just go to my website, drrebeccawarren.com. On there, I have a few different service options. I do have a membership community.
Mm-hmm.
I have one-on-one coaching options that if right now, I think that's on a wait list right now. But if it's not, like you can get in there and I can coach you through. It's just where you're at. We do have a way to schedule for a free call with a team member
Mm-hmm.
to help guide you like where you need to be. Because I don't want you to invest here, like, hey, I want to go in and start detoxing and doing all of this when you're still hypothyroid.
Mm-hmm.
Like, side note, let me add that really quick.
Okay.
Most of my clients that I'm working with should not be doing anything. They need to get their thyroid hormones optimal.
Mm-hmm.
A lot of you guys are hearing about parasite cleanses and doing this
Mm-hmm.
detox and doing all this, and you have your free T3 and the 2s.
Mm-hmm.
You have all these signs that everything's slowing down, and you think you can do all these protocols, and that's just a waste of money.
Mm-hmm.
You're not going to see results. So a lot of the times I have to kind of, let's stop a moment. Let's get your hormones optimal, or let's get the gut. Let's get your adrenals. Let's get you chilling out a little bit, and then you can go into that deeper. So just going onto my website, you can look at all the different options. You can reach out to my team and see like what maybe the right path is for you, because everyone's different.
Mm-hmm.
So drrebeccawarren.com.
And that will be in the description of this video for anyone watching. Please take a look down there. There's going to be the link to your podcast, the link to the podcast you did with Dr. Mindy, and the link to your site. And you've got some really great resources on your site. So definitely everyone watching this, check that out. I'm just thrilled that we got to have this conversation and that I stumbled across this podcast with you and Dr. Mindy, because it really was like a line in the sand for me. When I listened to it, I was like, I want to share what she's saying with my community. And so the fact that we're having this conversation today is just, it's like you said, full circle. It's so exciting to me to share what you're doing with all of these people in this community who they're looking for the same thing as me. They want, and as you were, as we are all trying to just figure out how to do this. We need someone to sometimes take us by the hand and not feel like we're all by ourselves trying to figure it all out on our own. Because, man, that is so frustrating. So thank you so much for the time today and for what you're doing and helping patients and for talking with me and sharing all of your story. This has just been fantastic. So thank you very much.
Thank you so much for having me. And of course, I've already told you this, but I want to thank you. And for everyone that's listening, I mean, I've said this to you, this is life-saving. This is life-saving information. The resources, the work you're doing, what you're putting out into the world. I know God's seeing it. You don't know how far-reaching this is. I remember feeling scared and lost and feeling like I had no options. And we are so blessed that we have your resources, that you've put in this work for all of us. From a former patient, essentially, who's gone through all of this, I thank you for everything you do for the community.
Thank you so much, Dr. Rebecca. Thanks so much for listening. Please share this content and help others. If you need resources, testimonials, and support, please join our patient community, Save Your Thyroid. You can also find me on social media and Substack under the media handle, It's Me, Chattanooga. Never forget to educate yourself and be your own advocate and save your thyroid.